My name is Musa and Fatimat, a 300 level healthcare management/nursing student of the Jpts Institute of Management Science and Technology in collaboration with Global Wealth University College, Lome, Togo. I am here to talk on the theme, the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. First, I will be speaking on virus. Virus is a small infectious agent that have a simple acellular organism with a nucleic acid and protein code element which lack independent metabolism and can only replicate within a living host. All viruses replicate with fidelity or mutation. This now takes me to the main topic, which is hepatitis. The term hepatitis means inflammation of the liver, and it is characterized by the presence of inflammatory cells in the liver tissue. The onset of the disease has an incubation period ranging from 14 to 60 days. A patient can be infected, but the surface antigen might not be active or might not damage the liver cells yet. For a patient to have been said to have infective hepatitis, the patient have to run a ELISA test, and if confirmed positive, the patient will go further to run other tests like liver function test, viral load test, and liver scan. If 2 out of the 3 tests mentioned is positive, such patient is said to have an infective hepatitis B surface antigen. Here are some symptoms of hepatitis B. 1. Dark urine. 2. Light stool. 3. Jaundice. 4. Fatigue. 5. Myalgia. 6. Anorexia. 7. Malaise. Hepatitis can be viral or non-viral. The non-viral hepatitis is caused by alcohol consumption and injection of toxins and toxic. Hepatitis can be viral or non-viral. The non-viral hepatitis is caused by alcohol consumption and injection of toxic substance or drugs, while the viral hepatitis is caused by a group of 5 known viruses designated as hepatitis A, B, C, D, and E. The viruses are responsible for most cases of acute viral hepatitis that are transmitted to human hosts enterically through the blood-borne route, through sex, and through immunoglobulin G, that is IgG, that is from mother to a child. An infected pregnant mother should be advised to get her child immunized within 24 hours of birth. Hepatitis B is not curable as hepatitis C, that can be cured with lepabirin and mu-eclusia tablets. Other hepatitis except B are curable with a specific food and drug management. But hepatitis B is not. It can only be managed and prevented through immunization. Vaccine for hepatitis B are available, but however, a significant portion of the population remain unvaccinated, and therefore they are susceptible to the infection. Hepatitis B vaccine is the first vaccine against major form of cancer. Here are some major treatments that can be administered on a hepatitis B patient. 1. Livolin. 2. Silibon 70 or Silibon 140 mg. There are other phospholipid drugs such as tenofovir and lamivudine. These phospholipid drugs are to help repair the tissues that has already been damaged, or the cells that has been damaged. But tenofovir has its own side effects on the kidney. Hence, patients on tenofovir are advised to always conduct kidney tests to check for renal failure. In conclusion, different studies has examined the hepatitis B surface antigen and the anti-hepatitis B surface antigen with a chronic hepatitis B viral infection, and discovered that the sequence variation is much, and it indicates clearly that the presence of hepatitis B surface antigen in the body has a higher rate of amino acid substitute, and hence hepatitis B surface virus cannot bind to hepatitis B surface antigen. Hepatitis B virus cannot bind to hepatitis B antigen in the same patient that has been vaccinated earlier. So I will advise for patients to go immunized against hepatitis B. Thank you.